Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist. In this presentation, we are going to look at how to calculate the amount of mitral regurgitation using Pisa, P-I-S-A, proximal isovelocity surface area. Proximal isovelocity surface area using color Doppler to measure the mitral regurgitation volume, mitral regurgitation fraction, and also assess the degree of mitral regurgitation. So this is going to be very basic concept oriented presentation so that we understand how we calculate the mitral regurgitant volume and why it is important to go through the steps manually, because technician or a cardiology fellow and you are taking an exam, this information is going to be extremely useful as it talks about the basic fundamentals, math, physiology, and flow and area relations. So let's begin with the feature presentation. As you can see in this 2D echocardiogram taken in a 4-chamber view with the mitral regurgitation, in a patient with a mitral regurgitation, we see two different things here. With a continuous wave Doppler, we see this very big regurgitant wave showing up, moving away from the transducer, which can be in the range from 4 to 6 meters per second or 400 to 6 centimeters per second. For this presentation, we are going to represent everything in centimeters. Centimeters, it will be easy for calculations and correlations. So 400 to 600, and of course this is the aliasing radius, which I'm going to expand in a minute. In order to calculate the mitral regurgitation volume, there are multiple things we measure in this setup, for which we're going to start off with the mitral regurgitation volume. Volume is basically the valve, the orifice area multiplied by the velocity time integral or interval. If we take this radius and by using the formula, we can calculate the regurgitant flow. In order to do that, first of all, we need to get a good image of the mitral regurgitant Pisa, or to get that, we need to bring the scale of the color variance in a color Doppler all the way to the level between 30 to 40, where we see this beautiful delineation of this regurgitant velocity. When you get this nice delineation, you use that velocity, which is like 34 here, and by plugging two numbers, namely the radius and the aliasing velocity, or the VA as it is called, we can calculate the mitral regurgitation flow by the formula 2 pi r square multiplied by aliasing velocity. So when we get this, we get the mitral flow, that is ml per second. Flow is different from mitral regurgitant volume. Flow is how much of blood is flowing back into the atrium during 1 second. We have the effective regurgitant orifice area, which is calculated by the regurgitant flow which we got here from this first calculation, and then we take the peak velocity of the mitral regurgitation jet. And when we divide these two numbers, we get the effective regurgitant orifice. What is the area through which there is leak happening through the mitral valve? So that's the area. Then the regurgitant volume, is going to be a different number, which is ml, and that regurgitant volume is going to be based upon the effective orifice multiplied by the VTI. Initially, we use the peak velocity to find out the EROA, but in order to find out the regurgitant volume, we use the VTI, that is velocity time integral or velocity time interval. So these two are separate numbers, but we are deriving them from the same mitral regurgitation of the continuous wave Doppler across the mitral valve. So let's keep these things in mind. There are a lot more things that we need to understand, because not only are we looking at mitral regurgitation flow, which is so many ml per second, we are looking at the mitral regurgitant volume, which is expressed as ml. Then we're going to look at the regurgitant fraction. What percent of the left ventricular output is going back into the left atrium? So we need to pay some more attention. So let's move on. We calculate the regurgitant flow rate, which I already talked about, the pi r square multiplied by aliasing velocity. We calculate the effective regurgitant orifice area, which I already explained to you by getting the regurgitant flow here from the top and dividing that by the velocity max, which is like 4 meters, 400 centimeters or 500 centimeters, whatever the velocity may be. We calculate the regurgitant volume, which is equal to effective regurgitant orifice area multiplied by the mitral valve continuous wave VTI. So you have to, as I said, there are three different terminologies used here, each depicting a different aspect of the mitral regurgitation. It still doesn't tell you how severe the mitral regurgitation is. It is just telling you there is mitral regurgitation, the volume of mitral regurgitation per second, and the mitral regurgitant flow per beat. All right, let's move on to some more real examples here. Here is a mitral regurgitant 2D and continuous wave Doppler. As you can see, there is a proximal velocity which can be calculated, and the main thing focused here is showing the two important parameters through the mitral regurgitation continuous wave Doppler, namely the peak velocity, which is 550 centimeters per second. Keep it 550 centimeters. That makes all the calculations easy. Then we have, see, this is in centimeters, so you want to keep this in centimeters. So 550 centimeters per second. 163 is the velocity time interval or integral. Let's move on to another example here. In order to find out what is the regurgitant volume, how much of the blood the left ventricle is trying to pump into the circulation going back into the left atrium. In order to do that, first of all, we need to calculate what is the volume going through the left ventricular outflow tract. How do we calculate the volume going through the left ventricular outflow tract, which is basically the left ventricular stroke volume? It's pretty easy. We calculate the area or the diameter of the left ventricular outflow tract, as you can see with my arrow here. And then with that, we get the VTI of the flow across the aortic valve, the ventricular aortic valve, and then we can calculate, this is, if the diameter is 20, keep it centimeters, 2.06 centimeters times pi, or R is 0.785. You get the cross-sectional area for 3.3 centimeters square. Multiply that by 19, it gives a stroke volume of 63 ml. Combine that with the heart rate, it will give you a cardiac output. So here, why am I concerned about left ventricular stroke volume? Because we're going to use this to compare how much of blood is going into the left atrium during mitral regurgitation and what is the regurgitant fraction. So let's continue. And here is a picture, composite picture of what we are trying to accomplish. We want to calculate the flow across the left ventricular outflow tract. We want to calculate the flow across the mitral regurgitant jet, and from this we can calculate what is the mitral regurgitant fraction. Here's the same example, but kind of magnified here. You can see here's the radius, how you measure that, and you set this alias so that you see this beautiful golden yellow outline of the regurgitant jet, proximal velocity. Here are some more examples. Here's a 0.97, which is a significant amount of regurgitation, as it is evidenced by filling more than 50% of the left atrium. Of course, when this is looking upside down, then you know this is from a transesophageal echocardiography technique, because the mitral regurg is coming towards the transducer. And here the velocity is 515 and the VTI is 161 centimeters. I'm showing you multiple examples so you become familiar with the terminology, the concept. The more you do, the better you get at it. That's the point. Here's another example of the left ventricular diameter, 2.3, and it gives you a stroke volume of 81. Nowadays, all the echo machines calculate all this regurgitant volume, stroke volume, and all these things. But in the exam, you have to calculate. You better know what these things are. And here we have the LV outflow tract velocity time interval, 19.3, 20.3. And using these two, you can calculate the stroke volume. Of course, the computer combines these two to get the left ventricular outflow tract stroke volume. And on the other hand, we have the mitral regurgitation jet here, and it is calculating the VTI to be 166 and a maximum velocity of 488 centimeters per second. So we're going to use these two numbers to find out the mitral regurgitant volume. So once we get a mitral regurgitant volume, we know the stroke volume, we know the mitral regurgitation volume, we can calculate the mitral regurgitation fraction. So this is a sort of going step by step. What I already explained, I'm repeating this because repetition makes things more relevant. Maybe a point you missed in the first presentation, you will pick it up. So here we have the radius 1.1 centimeters, which is by itself signifying significant mitral regurgitation, and multiply that by velocity, which is 35.9. It gives you a regurgitant flow of 273 ml per second. Please pay attention to these. Units. It's very important. The flow is per second. How much blood is flowing across the valve per second? But that's not what we are looking at. We are looking at regurgitant volume. So the next step is to calculate the regurgitant volume. How do we get to the regurgitant volume? Easy. We calculate the effective regurgitant orifice area by taking the flow, which was in the previous slide, like 273 ml. Then we take the peak velocity, which is like 640 centimeters. So you get a regurgitant area of 0.43 centimeters square. So that's a fairly good size leak across the mitral valve. From there, you can calculate, you know the area, then you know the velocity. By this, you can calculate the regurgitant volume, which is 91 ml. And now the third step is, we know what the regurgitant flow is, 273 ml per second. We know what the effective regurgitant area is, 0.43, and we know what the regurgitant volume is, which is 91 ml. And finally, we can calculate the regurgitant, it's just repeating the same thing we said. We can calculate the regurgitant fraction. That is, we take the regurgitant volume to be 101 ml. Then we have the regurgitant fraction is regurgitant volume divided by stroke volume, which is 101 divided by 147. You get a regurgitant fraction of 69%, and this signifies severe mitral regurgitation as it is greater than 50%. Putting all these things together, we need to look at the 2D echocardiogram. We need to look at the left ventricular function. We need to look at the left atrial size. We need to look at the vena contracta. We need to look at the regurgitant volume, regurgitant fraction, regurgitant orifice. Based upon these things, we can quantify the degree of mitral regurgitation. We need to look at the left atrial and left ventricular size and function, which is good. So we start off with the Pisa radius. If the Pisa radius is vena contracta, which is 0.3 to 0.69, is moderate, and anything greater than 0.7 centimeters is severe. Here are some examples of trace mitral regurgitation, and here is a moderate mitral regurgitation. As you can see, the mitral regurgitation max velocity is almost 411 centimeters, VTI 139, and here is a severe mitral regurgitation with a velocity of mitral regurgitation velocity of 600 centimeters per second. So this gives you a very good concept of what is mitral regurgitation, how do you determine what is the mitral regurgitation volume, what is the mitral regurgitation fraction, and what is the severity of mitral regurgitation. Combine that with the color Doppler and also 2D echocardiogram, looking at the left atrial size, left ventricular function, left ventricular size. You can determine the degree of mitral regurgitation with great precision. Thank you so much. I hope it has been useful to you, and please do take a look at the book I have written on echocardiography and Doppler reference book, which has every normal and abnormal values, including calculations, and what are the things you need to look for if you are doing an echocardiogram on a patient or reading an echocardiogram on a patient with, say, aortic stenosis or mitral regurgitation. Not just the Pisa or the regurgitant volume. You have to look at the whole picture. So what are the associated findings that you need to look for? It's all explained in this book. Thank you so much. We'll see you in the next presentation.